Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We're pleased to welcome Dr. Omar Hamada, an accomplished physician and business executive with an acute focus on performance optimization and longevity management. Welcome, Dr. Hamada. You've built a diverse and expansive career in medicine, serving as a flight surgeon and diving medical officer within the United States military, an emergency physician, an obstetrician-gynecologist, and more. How did your career in medicine first begin?
Yeah, it's been quite interesting and taken a few turns. I actually started medical school wanting to be a cardiothoracic surgeon after reading Christian Bernard's One Life. He was the first physician in the world to do a heart transplant and did it in South Africa. So I came to med school with that in mind, and as most med students, ended up switching to neurosurgery. Long story short, my wife at the time didn't want me to do neurosurgery and begged and pleaded that I not because of time commitments. So I ended up switching actually and did a family medicine residency. Was very procedurally aggressive and really enjoyed it, but ended up missing the operating room and ending up going back into a surgical specialty and did OB/GYN. So 9/11 happened. I was in the Special Forces at the time as well, in the reserves, National Guard side, and ended up going to Afghanistan in 2002, 2003. And then after that, came back and was chair of OB/GYN at a hospital in Nashville, Tennessee. I'd been accustomed to academic medicine and military medicine, never corporate medicine. So the hospital system and I didn't really get along because I feel like I was really focused on patients and they were really focused on the bottom line and revenue. So I switched and ended up going to Pfizer as a consultant in gynecology and pelvic health. And enjoyed my time there, but again, just that corporate atmosphere as a physician just didn't really sit well. I'd been doing emergency medicine throughout longitudinally as a family physician. So came back in 2010 and went full-time in family practice. Like most of us here at A4M, I think at some point, I don't remember the exact time, but at some point I felt like, all we're doing is managing chronic disease. And I'm not really getting anyone well unless I'm cutting on them surgically. But medically, all we do is really just manage chronic disease with medication, whether it's diabetes or hypertension or what have you. And I thought there's got to be something else. There's got to be a different way, a better way. So started researching other ways in medicine of trying to help patients get healthy again, and realized that a huge part of that is actually the patient's motivation and the patient's decision and the patient's choice. But I could help them, like a health coach, as a physician, to get better if they really wanted to. So that's been sort of my journey, very shortly and concisely. There's been a lot more there, but that's basically it.
So that is quite a diverse background and journey. Afghanistan, tell us a little bit about that experience, because that's not something that many physicians have.
Yeah, that was quite interesting. I got into the Guard in medical school in 1989 and was in a MASH unit at first. It was great for 4 years just to learn how to wear a uniform and salute, but I got bored and went to Fort Sam Houston in Texas, and we were doing combat casualty care. And I started fitting in better with the Green Berets than I did with the physicians. So at the end, they actually came to me and said, "Hey doc, how'd you like to go to the Special Forces?" And I was like, "I'd love it." So 9/11 happened. We all remember what happened. Immediately that day, we got spun up and got notified that we were getting a warning order from Fort Bragg. And a few months later, we deployed to Afghanistan. Actually, initially to K2, which was a secret Russian air base in Uzbekistan, just north of the border, and we deployed from there into Afghanistan proper.
And so what was your role in Afghanistan?
So, a battalion surgeon, flight surgeon, diving medical officer's role in peacetime is different than wartime. And in wartime, it was basically well, before we went over, to make sure that all of the Green Beret medics, the 18 Deltas, were properly trained, had all the proper certifications, make sure that all of our troops were ready to go from the medical perspective, had our HIV tests done, our DNA put in the repository, and were physically able. And then during wartime, my job was to advise the commander of any medical issues that were important, health-related issues that were important that would affect the troops, and then also to visit the bases around the country and make sure that all of my medics were squared away and able to function the way they were trained.
Yeah.
So,
I imagine that was a remarkable experience.
It was.
Yeah.
It was. One thing you realize is, the Geneva Convention is there for a reason, but it doesn't really matter in wartime. Everybody's a combatant when you're getting shot at.
Yeah. So, tell us about your practice today.
So, the past couple of years have been rather interesting, just with healthcare and medicine. And we know that over the past couple of decades, there's been sort of a division between healthcare and medicine. I view medicine as the message of hope and healing that we give to our patients, that's backed by science and the art of practicing medicine. Healthcare, on the other hand, is the business. It's how that message is delivered. Unfortunately, as physicians, we've been taken out of the middle. And insurance companies and hospitals and pharma companies and device companies are now all sort of running the show, the government. We're trying to recapture that, and now through direct patient care being one of those models, we're able to engage the patient again. My practice over the past few years has really transitioned, as I said before, from one where I was managing chronic disease and then cutting it out when it needed to be cut out, to one where we're now trying to reverse disease, get people healthy again. Instead of helping them live longer lifespans, we want to help them live longer health spans. We know that as Americans, 70% of us are overweight, probably 40% obese. At 50 years of age, many are taking handfuls of medicines. What we're trying to do is make 70 the new 40. Like Peter Diamandis says, 100 the new 70, I guess. Help people live into the triple digits, sort of like what Dan Buettner talked about in his book, Blue Zones, using vegetable-based Mediterranean-style diets, active lifestyles, and socializing the elderly and other things.
I think perhaps the general public thinks, or I've certainly heard it many times, okay, diet, sure, we've all heard diet. But it really is, let food be thy medicine and medicine be thy food. It really is the key pillar, isn't it, to health?
It really is, Phil. And I was in a conference, this has probably been about 5 years ago, when a physician was speaking to a group of physicians in the room, probably 500 of us. And he said, what percentage of a patient's health is dependent on you as a physician? And most of us think, 50, 80%, whatever. And he said, no, it's only 10%. And most of that's surgical. 50% of a patient's health is based on their habits and their choices every day. And most of that's diet and nutrition. 20% on the environment, the toxins that we breathe and drink and eat that are in our air, food, and water. And then probably 20% genetic. But some of that's modifiable, as we know, like a light switch. We can turn some genes on and off based on their environment, stuff we're putting in our bodies. So it's really interesting that now we see, and we're pushing patients, encouraging patients to get motivated to be responsible for their own health.
Right. And so it is lifestyle medicine in that regard. But let's talk a little bit about some of the things that can be done in terms of turning on and off, genes and some of the tools that are coming available, peptides and things like that. What are some of the tools that so-called anti-aging, functional medicine, integrative medicine tools that you're using in your practice?
There's so many, and the thing is, they just keep coming faster and faster. So sometimes it gets challenging to keep up for many of us. But what we know is we just go back to the basics. There's so many fads that come and go from, with regards to diets or special supplements or special exercise programs or what have you. But if we go back to the basics of eating a healthy vegetable-based diet, taking needed supplements, things like that, I think we can really remarkably change a patient's lifespan and health span and lifestyle. Some of the things we do is really try to do full testing with genetics and metabolomics, intracellular testing to see where patients really have deficiencies. I mean, for example, in medicine we test the serum, the blood, and we say somebody has a certain level of a certain component, let's say vitamin D. But what we don't tend to look at in general, that we're looking at now, are vitamin D receptors on the cell membranes and intracellular concentrations of vitamin D. So ultimately, it doesn't really matter what the serum levels are. What matters is what's inside the cell that's available for use. So that's really where we're trying to push the envelope, is what are we giving our mitochondria, what are we giving our cells that are available for optimal use and health and function, in combination with all the other modalities like stem cells and PRP and BHRT, right, and all of it. So I think it's another great addition to the armamentarium that we have available to us.
Right, right, and that's always been the problem, is people are looking for that silver bullet, that magic pill, the one thing, and that's kind of what this is all about. It's not one thing. Right. In fact, I think that anti-aging integrative functional medicine is kind of definitely moving away from that silo approach that traditional medicine has been in, and understanding that it's mind, body, spirit. It's your entire being, and one system affects the next.
Exactly, and I think that's been one of the problems, is we look for that one silver bullet, and it becomes a fad that goes away as quickly as it came. We know that what we're trying to do really is three things, and we use stress reduction and exercise and diet and everything combined to do it. And those are decreasing oxidative stress, decreasing inflammation, improving immune system function, and ultimately that's the basic thing. One company that I run, it's really interesting. It's actually a survival and security company. We train civilians in survival and security, and we only use ex-Delta Force, Navy SEAL, Special Forces, CIA operatives to do that. At one of our courses, one of the students asked one of the Delta Force guys, and I'm going to apply this to medicine, to what we do, because it was so powerful. He asked him, I want to be high speed like you. How can I get to be high speed like you guys in Delta Force? And the guy, without missing a beat, said, we're not high speed. We're just ordinary guys just like you. What we are, though, is experts in the basics. We do the basics better than anyone else in the world. And that's what medicine is. I mean, that's what we do here, really. We're not looking for a silver bullet of this is the answer. We need to really focus on the basics and nail those down. And once we can apply those to a patient in an individualized fashion because of specific testing, we can radically change their outcomes, their life, their health, their outlook, everything.
Along with being a physician, you are also an actively engaged business entrepreneur and business executive. As both a physician and businessman, how, if at all, do your medical experiences and knowledge influence your business practices?
Phil, that's a great question. Before I went to business school as a physician, I thought I knew about business. And of course, all of us do, because we all tend to be fairly intelligent, although very siloed. But the fact is, we really don't know anything about business. I'd recommend that every MD get an MBA. I ended up going to Vanderbilt Business School at Owen and loved it, and it was so worthwhile. It's something that I'm so glad I did, because it opened my whole world to a different language, to a different approach, to understanding spreadsheets and understanding how to apply what I know in a business format in order to make it self-sustainable and have a self-running company, as Dan Sullivan, as strategic coach, says. He's been one of my coaches, and I love the guy. So I think we live in a world of applied medicine in a healthcare format, and I think entrepreneurship is essential. Understanding entrepreneurship, understanding business is essential to what we do. Because if we can't do it well and make it succeed as a business, our patients aren't going to benefit, because we're not going to be able to do what we do.
So you're saying businesses. Tell us a little bit about your different companies that you're running.
Sure.
Or involved in.
Yeah. So there are several. One, of course, is just being a physician and having a practice that does this. I also do emergency medicine, which I enjoy it. I do it. I punch in, punch out, and that's it. I have that one business executive operations group that I was talking about before, where we do training of civilians in tactical shooting mindset, situational awareness, first aid, improvised weapons, survival type stuff. And then another, I've partnered with OsteoStrong and own a franchise. John Jakowicz invented the concept of osteogenic loading. Actually, he didn't invent the concept, he invented the mechanism by which we can do it safely, and actually increase bone mineral density by up to 10% per year, even in 80-year-old osteoporotic women. So for the first time, we're seeing reversals in osteopenia and osteoporosis that medications and supplements can't do.
What's the method?
It's basically loading the bone in its long axis with at least 4.2 times your body weight, generating those forces where the brain says we need more bone structure. A pill's not going to do it. Regular weight-bearing exercise isn't going to do it. What we've discovered is the only exercise that does it is gymnastics, professional Olympic-style gymnastics, which most of us never do, or can't do.
Right.
So how do we generate 4.2 times our body weight along the long axis of a bone? Most of us, when we lift, can only lift at our weakest point. So for example, let's say a guy, maybe 200 pounds, 225 pounds, but that's just a little over most people's body weight. To generate 800 pounds of force or more, you've got to be at your strongest point. So these mechanisms that Dr. Jakowicz has developed actually capitalize on that. So we're generating thousands of pounds of force through our bones that trigger the brain to cause the osteoblasts to lay down new bone structure to strengthen the bone in the framework.
Wow.
So that's another. After business school, a few of us got together and started a company called RX Genomics, and it's pharmacomanagement based on genetics. So we look at your CYP450 enzyme system in your liver, see what medications you metabolize as a slow metabolizer, normal, or fast metabolizer, or not at all. You're going from a prodrug to the active form. So like, for example, we know Plavix or Coumadin, only 17% of people can't metabolize it because of their liver enzyme systems, their genetics. So they will reclot, they'll restenose. So how do we avoid that? We test them first, and then we prescribe the right medication. So that's another thing I'm involved in.
Wow. So you're involved both as a practicing physician and also in some really cutting-edge therapies as well as science.
Right.
With that unique perspective, what are you most excited about in medicine in the next 10 or 15 years, as quickly as technology is developing and as quickly as we're kind of seeming to turn here?
I'm most excited about really increasing our health span and reversing chronic disease, helping people live fuller, more active, more fulfilling lives through the choices they make. And a lot of that's education, because a lot of patients, given where we are today, have become accustomed to going to their physician and saying, I'm feeling this symptom or I have this issue, give me a pill. Mm-hmm. But we want to get away from that mentality and help train patients to understand that much of their health is in their hands, and that we have other modalities now other than just pills to help heal them, stem cells, peptides, supplements, other types of diets and exercise, where we can short circuit the time between where we are now and where we want to get, biohacking, whether it's with our brain using neurostimulation, whether it's with our cardiovascular fitness using something like one of my friends recently invented, Peter Wazowski, with VASPER, with compression, cooling, and high-intensity exercise. Mm-hmm. There's so many great biohacks that are available now that actually help us get healthier quicker. Mm-hmm. Because most of us don't have the patience to do something for years on end before we see a result. We want to see it more quickly, and we're getting there.
Yeah, very true. Yeah. Well, thank you so much for joining us today.
My pleasure. Thanks for having me.